Commission plays an independent role in this process.
Question number 12, Right Honourable Winston Peters.
Mr. Speaker, this question is to the Prime Minister and asks, does he still have confidence in the Associate Minister of Health, and if so, why?
Right Honourable Prime Minister.
Mr. Speaker, I have confidence in all three Associate Ministers of Health because they are working hard for a brighter future for all New Zealanders.
Supplementary question, the Right Honourable Winston Peters.
With respect to Mrs. Tariana Turia, how can he have confidence in this Associate Minister of Health, given that she has paid $7.6 million in public money to traditional Maori healers over the last 4 years, without being able to provide a shred of evidence that the treatment works?
Right Honourable Prime Minister.
Mr. Speaker, I don't believe that to be correct, in so much that the contracts are regularly monitored by the Ministry of Health. Most providers provide reports against that contract every 6 months. The contractors' providers also are audited by the Ministry through a mix of desk-based audits and visits. And if we look at the number of people that have received those services over that period of time, in broad terms it adds up to a touch over 50,000 individuals.
Right Honourable Prime Minister, Right Honourable Winston Peters, supplementary question.
Sir, I always thought you were a soothsayer. How can the Prime Minister support a policy which sees the taxpayer forking out $130 per client contact for something that the practitioners say may be no more than a service such as, to use their words, as simple as a smile, inner quotes?
Right Honourable Prime Minister.
Mr. Speaker, I think what the member is referring to is rongoa services, which are used by clients for a number of different reasons, but in line with the Maori culture. And they can include everything from therapy right through to massage. In fact, that is not unique to Maori. We provide also significant funding for chaplain services, and I'm assuming the member is not telling New Zealanders that he thinks that when someone is potentially on their deathbed in a hospital that they shouldn't receive the support that they might receive from a chaplain in their final days.
Supplementary question, Right Honourable.
Given that the chaplaincy service has nothing to do with whatsoever, is Rongoa Maori receiving millions while every other alternate provider has been shut out of this process, or Mrs. Turia's excuse for Rongoa Maori not being held to the same scientific standards as other medical procedures because, to use her words, it is more of a spiritual thing, end of quotes, not just plain, unadulterated racial discrimination?
Right Honourable Prime Minister.
So it's important that we understand what the member is talking about. He's talking about the expenditure of $1.9 million out of a budget per year, out of an annual expenditure of about $14.5 billion. We're talking about, in 2010-11, 19,378 people around the country receiving support which may have been mental and spiritual in nature, very akin to chaplaincy services. So the member gets in the House and complains about this.
Point of order, Right Honourable.
Mr. Speaker, I think I've given him a long enough time to answer my question, which was, are these two examples, alternative providers being shut out, and that it's a spiritual thing as an explanation, not just plain, unadulterated racial discrimination? That's the question I'm asking him. He might not like to answer it, but he's got to address that question.
Right Honourable Prime Minister.
I'm quite happy to answer it. These are services paid for by the government that have as part of them, they are spiritual services. That's quite correct. They provide support for people in need. Anyone can access if they choose to. And by the way, the member's not on his feet talking about chaplain services because he knows that would offend his base, but he's quite happy to attack the spiritual beliefs of others.
Point of order.
Again, Mr. Speaker, I've asked him the question as to why it is not racial discrimination. He's putting up the chaplaincy service, which is a rather weak point, because we financed 500,000 last time I was a minister.
Order. The member, the Prime Minister, has answered that. He said it wasn't racial discrimination in his opinion. It was delivering it to New Zealanders in need. Have you had further supplementary questions? We move now to questions for members in the name of Leo Awha Mulia Asanati Lole Taylor.